So, hey guys, this is just a little review for cranial problems. But everything I'm doing, vault hold them right here. This is if I have a switch from here or here, I'm always like this. Anytime I say an axis, I say an AP axis, this is the axis I'm talking about. If I'm talking about vertical axis, this is the vertical axis I'm talking about. If I'm talking about horizontal axis, transverse axis, this is the axis I'm talking about. And this is how I hold the patient. So, now, first one we're going to talk about is torsions. Quick and easy way to memorize torsions is your hands are like this, and this is how it's going to move. Okay? So, if I'm like this, my right index finger is pointing up, so you know this is a right torsion. It's a quick way to get this. So, the actual hand motion that you're probably going to be looking at is kind of like, it's a little more detailed than just straight like that. But quick way is just getting it like that. So there's one axis that we're working on with this one, and it's the AP axis. Going straight up and down, that's going straight through that SBS area. Oh my gosh, going straight through like this, okay? From your point of view, like this. So this is the quick and easy movement. And we got one AP axis coming down like this. So my sphenoid bone is moving like this. I'm gonna do that first before I throw my finger in. So now with my finger's here, that's why I was saying like the actual movement's more kind of like that instead of just straight like this. So that's how the movement's going. Since this one's superior, since this one's superior in referencing to the patient, that's what we name it for that side. Okay? So now the occiput's gonna be going the opposite direction. So that's how this one's rotating about that AP axis like this, and that's how you get that motion right there. So that's the torsions. Next one, side bending. Quick and easy way. Hands like this. One goes caudad, one goes cephalad, one goes inferior, one goes superior in referencing the patient. Well, this is what my hands look like from the side. Still, the patient's this way. One hand goes towards the patient's feet, or caudad, and my fingers separate. Alright? The other hand comes cephalad, or superior, and my fingers approximate. That's the whole motion. To get all these motions in, we have to have 3 different axes. So the first axis we're going to talk about, or I guess the quick and easy way, if my hand's like this, whichever hand is separating, it's gone down and separated, that's how we name it. So if it's like this, it's a right. If it goes like this, it's a left. That's when you're naming it for whichever one the sphenoid bone is more anterior when referencing the patient. So the first motion we're going to talk about is this motion. That has to be done about the AP axis again. Except this time, which difference from torsions is both of them are going to be rotating in the same direction. Okay, so this is how you get that motion right there. Okay, so this is how this is happening. So now to get the actual rest of it, we're going to have 2 different vertical axes. Okay, first axis comes through the foramen magnum. Through the foramen magnum like that, easier like that, so you can see. And then the other one through the center of the sphenoid bone. Okay. So first axis rotation, the AP axis, boom. Okay. So now they're going to rotate like this across those vertical axes. So this is rotating on this axis like this, like this. Okay. So we've got our rotation, but the AP axis rotation in opposite directions about the 2 vertical axes. Okay, and that's how I get my fingers to go from here, only looking at this hand. My hand goes down and separates. That's how that happens. And that sphenoid bone's more anterior, so that's the side we're naming it for. Like I said though, quick and easy way, whichever fingers separate. Next one is vertical strength. So we've got 2 transverse axes, okay? So an axis about in this area right here, about this area here. You got one for the sphenoid, one for the abdomen. Quick and easy way. for vertical strains is just do the opposite of the pinky. If this pinky's pointing superior, then you know that it's a inferior strain. This pinky's pointing inferior, no, it's a superior strain. The actual movement is more like, so for a an inferior strain, inferior vertical strain, the movement's kind of more like this. So the pinkies are moving inferior, but they're pointing up. Okay, so that's why, I mean, it's a superior strain. This is the actual movement, but the easy, quick way, if you're told it's like this or like this, just remember, no, it's opposite of the pinky. So, same thing, when we're here, to actually get the superior strain, this is how the bones are going to move, okay? To get the inferior strain, this is how the bones are going to move. And you can see how it's rotating about the transverse axis, okay? So for a inferior strain, the sphenoid bone's moving like this. So to keep my hand on that sphenoid bone, it has to go like that. Same thing here. If it's an inferior strain, that's the way it's moving. This is where we're talking about, like, the pinky's technically moving inferior when talking about the patient, but I just say it's opposite, pointing up, so you know it's a inferior strain. So now do the opposite. If it's a superior strain, where the sphenoid rotates about like this, to keep my hand on it, my hand has to move like that. Pinky's pointing down, just know it's opposite of the pinky, so that's how you know it's a superior strain. Same thing here. This moves like this. So for a superior strain, that's how you keep it on. Both going about the transverse axes that are about right there, okay? And then last one is lateral strains, okay? So this one we've still got the same two vertical axes we've been working on this entire time, okay? So if we're here, you're going to basically, quick and easy way, lateral strains. This is what it looks like, okay? This one you can just follow the pinky. My lateral strains like this, you know that it's left lateral strain, right lateral strain. Okay? So a quick way to do lateral strains, follow your pinkies. If my lateral strain goes this way, it's right. Lateral strain goes this way, it's left. So now if we're looking at it like this, we've got two vertical axes, same ones that we've been working with this entire time. Alright? So the center of the sphenoid bone is pointing to the left. That's a left lateral shear. Center is pointing towards the right. That's a right lateral shear. Okay? So same motion here. Left lateral shear. Right lateral shear. Same thing here. That's how they're moving. Rotating about that axis. So it's actually kind of more, that's like the actual motion of it, but that's the quick and easy way to memorize it. And then we've got, as you know, flexion, extension, and then compression is literally just compression. And I believe that's it.